Title: Demystifying Diabetes, Unveiling its Main Causes and Effective Treatment. In today's fast-paced world, where convenience often trumps health, diabetes has become a prevalent concern affecting millions worldwide. Understanding the main causes of diabetes and its treatment is crucial in managing this chronic condition and improving overall well-being. Main causes of diabetes. Diabetes is a multifaceted condition, but its primary causes can be broadly classified into two types, type 1 and type 2 diabetes. Type 1 diabetes, often diagnosed in childhood or adolescence, is primarily caused by the immune system attacking and destroying insulin-producing cells in the pancreas. On the other hand, type 2 diabetes, which typically develops in adulthood, is closely linked to lifestyle factors such as poor diet, lack of exercise, and obesity. Both types share a common outcome, elevated blood sugar levels, but understanding the underlying causes is pivotal in effective management. Understanding the link between lifestyle and diabetes. In today's sedentary lifestyle, where convenience foods laden with sugar and unhealthy fats are readily available, the prevalence of type 2 diabetes is soaring. Poor dietary choices, coupled with a lack of physical activity, create a perfect storm for insulin resistance and elevated blood sugar levels. Addressing these lifestyle factors is paramount in preventing and managing type 2 diabetes. Incorporating a balanced diet rich in whole grains, fruits, and vegetables, along with regular exercise, can significantly reduce the risk of developing diabetes and its associated complications. Genetic predisposition, a contributing factor. While lifestyle choices play a significant role in the development of type 2 diabetes, genetic predisposition also plays a crucial role. Individuals with a family history of diabetes are at a higher risk of developing the condition themselves. However, genetics alone do not determine one's fate. By making positive lifestyle changes and adopting healthy habits, individuals can mitigate their genetic risk factors and lead a fulfilling life, despite the odds. The role of insulin in diabetes management. Effective treatment of diabetes revolves around managing blood sugar levels to prevent complications. For individuals with type 1 diabetes, insulin therapy is the cornerstone of treatment. Since their bodies no longer produce insulin, regular insulin injections or the use of an insulin pump are necessary to regulate blood sugar levels. In contrast, individuals with type 2 diabetes may initially manage their condition through lifestyle modifications such as diet and exercise. However, as the disease progresses, oral medications or insulin therapy may be required to achieve optimal blood sugar control. Holistic approaches to diabetes management. While medication plays a crucial role in diabetes management, adopting a holistic approach that addresses the mind, body, and soul is equally important. Stress management techniques such as mindfulness meditation, yoga, and deep breathing exercises can help reduce stress hormones that can elevate blood sugar levels. Additionally, incorporating adequate sleep into one's routine is vital, as sleep deprivation can impair insulin sensitivity and exacerbate diabetes symptoms. The importance of regular monitoring and education. Living with diabetes requires vigilance and self-awareness. Regular monitoring of blood sugar levels, either through self-testing or continuous glucose monitoring systems, allows individuals to make informed decisions about their treatment and lifestyle choices. Furthermore, ongoing education about diabetes management, including the importance of nutrition, exercise, and medication adherence, empowers individuals to take control of their health and lead fulfilling lives, despite the challenges posed by the condition. Conclusion: empowering individuals to manage diabetes. In conclusion, understanding the main causes of diabetes and its treatment is pivotal in effectively managing this chronic condition and improving overall well-being. By addressing lifestyle factors such as diet, exercise, and stress management, individuals can significantly reduce their risk of developing diabetes and its associated complications. Moreover, adopting a holistic approach to diabetes management that encompasses both traditional medical interventions and complementary therapies can empower individuals to take control of their health and lead fulfilling lives despite the challenges posed by the condition. Remember, diabetes may be a part of your life, but it doesn't define who you are. With the right knowledge, support, and determination, you can thrive despite diabetes. Treatment. Depending on what type of diabetes you have, blood sugar monitoring, insulin, and oral drugs may be part of your treatment. Eating a healthy diet, staying at a healthy weight, and getting regular physical activity also are important parts of managing diabetes. Treatments for all types of diabetes. An important part of managing diabetes, as well as your overall health, is keeping a healthy weight through a healthy diet and exercise plan. Healthy eating. Your diabetes diet is simply a healthy eating plan that will help you control your blood sugar. You'll need to focus your diet on more fruits, vegetables, lean proteins, and whole grains. These are foods that are high in nutrition and fiber and low in fat and calories. You'll also cut down on saturated fats, refined carbohydrates, and sweets. In fact, it's the best eating plan for the entire family. Sugary foods are okay once in a while. They must be counted as part of your meal plan. Understanding what and how much to eat can be a challenge. A registered dietitian can help you create a meal plan that fits your health goals, food preferences, and lifestyle. This will likely include carbohydrate counting, especially if you have type 1 diabetes or use insulin as part of your treatment. Physical activity. Everyone needs regular aerobic activity. This includes people who have diabetes. Physical activity lowers your blood sugar level by moving sugar into your cells, where it's used for energy. Physical activity also makes your body more sensitive to insulin. That means your body needs less insulin to transport sugar to your cells. Get your providers okay to exercise. Then choose activities you enjoy, such as walking, swimming, or biking. What's most important is making physical activity part of your daily routine. Aim for at least 30 minutes or more of moderate physical activity most days of the week, or at least 150 minutes of moderate physical activity a week. Bouts of activity can be a few minutes during the day. If you haven't been active for a while, start slowly and build up slowly. Also avoid sitting for too long. Try to get up and move if you've been sitting for more than 30 minutes. Treatments for type 1 and type 2 diabetes. Treatment for type 1 diabetes involves insulin injections or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting. For some people with type 1 diabetes, pancreas transplant or islet cell transplant may be an option. Treatment of type 2 diabetes mostly involves lifestyle changes, monitoring of your blood sugar, along with oral diabetes drugs, insulin, or both. Monitoring your blood sugar. Depending on your treatment plan, you may check and record your blood sugar as many as 4 times a day or more often if you're taking insulin. Careful blood sugar testing is the only way to make sure that your blood sugar level remains within your target range. People with type 2 diabetes who aren't taking insulin generally check their blood sugar much less often. People who receive insulin therapy also may choose to monitor their blood sugar levels with a continuous glucose monitor. Although this technology has not yet completely replaced glucose meters, it can reduce the number of fingers needed to check blood sugar and can provide important information about trends in blood sugar levels. Even with careful management, blood sugar levels can sometimes change unexpectedly. With the help of your diabetes treatment team, you will learn how your blood sugar levels change in response to food, physical activity, medications, illness, alcohol, and stress. For women, you'll learn how your blood sugar levels change in response to changes in hormone levels. In addition to daily blood sugar monitoring, your provider will recommend regular A1C testing to measure your average blood sugar level for the past 2 to 3 months. Compared to frequently repeated daily blood sugar tests, the A1C test better shows how well your diabetes treatment plan is working overall. High A1C levels may indicate the need for a change in your oral medications, insulin regimen, or meal plan. Your target A1C target may vary depending on your age and various other factors, such as your other medical conditions or your ability to sense when your blood sugar is low. However, for most people with diabetes, the American Diabetes Association recommends an A1C of less than 7%. Ask your provider what your A1C target is. Insulin. People with type 1 diabetes must use insulin to manage blood sugar to survive. Many people with type 2 diabetes or gestational diabetes also require insulin therapy. There are several types of insulin available, including short-acting, regular insulin, rapid-acting insulin, long-acting insulin, and intermediate options. Depending on your needs, your provider may prescribe a mix of types of insulin to use during the day and night. Insulin cannot be taken orally to lower blood sugar because stomach enzymes interfere with the action of insulin. Insulin is often injected using a fine needle and syringe or an insulin pen, a device that resembles a large ink pen. An insulin pump may also be an option. The pump is a device the size of a small cell phone worn outside your body. A tube connects the insulin reservoir to a tube, catheter, that is inserted under the skin of your abdomen.